Lance.
Sean.
Maddie.
Colton.
Timothy.
JR.
Hi, my name is Cameron Baker, and today I aim to tell you how to properly take someone's blood pressure manually. Frank Sonnenberg, the award-winning author, once stated that trust is like blood pressure. It's silent, vital to good health, and if abused, it can be deadly. This quote is talking about trust, but it also indicates the importance of having a healthy blood pressure number. Your blood pressure is essential to living. Having a healthy blood pressure is essential to living a happy life that you can be active in and not worry about health issues. In this speech, I aim to discuss the different equipment and tools necessary to manually take someone's blood pressure. Then I aim to discuss how to do the process of taking someone's blood pressure. And finally, I want to discuss how to interpret those results and what to do about them. So I'm going to start off with my equipment. This is a blood pressure cuff. It's one of the more common pieces of blood pressure taking equipment. A lot of people know about it. It's very common. This cuff is actually very important. It's a modernized way to take blood pressure because according to the American Diagnostic Corporation, it wasn't until 1881 that this cuff was manufactured. Previously, they would take a glass tube and insert it to animals or human arteries in order to measure that pressure in the artery. So this is actually a very safe and non-invasive way to take blood pressure. Another piece of equipment is going to be this bulb. This bulb is what's going to be used to pump air into the cuff, inflating it. Another piece of equipment is attached to the bulb is the air release valve. The air release valve is control of the air inside of it. If it is closed, the air will not escape the cuff, and if it's open, the air will be able to come out of the cuff, releasing pressure on the patient. Another important part is the gauge. The gauge has numbers labeled 0 to 300, and it is what's going to be able to record the number values of a blood pressure. Finally, we have a stethoscope. This is a very common piece of blood pressure equipment, and it's used in a lot of medical facilities. This is going to be able to listen to the heart rate and the pulse that is created by the restriction of the artery in order to record that blood pressure number. So, one of the most important parts of the blood pressure process is taking care of the patient. You want to make sure that they are calm, happy, and that most importantly, that their arm is at heart level. If their arm is elevated above heart level, that will result in a high reading, and if it is below heart level, it will be a low blood pressure reading that is not correct or accurate. So I'm going to start by putting the cuff on the patient. You want their palm up in order to expose their artery, which is where you'll get the pulse reading. So I'm going to tighten this an inch above the elbow crease because that's where my stethoscope is going to go. I'm going to talk my way through the process before I actually complete it because it needs to be quiet so I can hear the pulse and the reading on her arm. So the first thing I will do when I begin is pump this in order to get the gauge to read 180 pressure. When it gets to 180, I'm going to turn the air release valve very slowly so it slowly releases pressure off of her arm, and that will enable me to get a reading. The whole time I'll be listening with my stethoscope to hear certain elements which I'm about to explain. So as I just mentioned, what I'm listening for is a knocking noise, which is really her pulse, her blood in her veins. So around 120, which is the normal standard for a systolic reading, which is the pressure on an artery in contraction, is going to be 120. And so around 120, I'm going to listen for that knocking noise, the pulse in her vein. That pulse is going to continue until around 180, which is the diastolic reading, which is the pressure on the artery when it is not contracted, when it is relaxed. The heart is relaxed and not pumping. So I'm going to begin this process, and when I hear the knocking begin and when I hear the knocking stop, I'm going to record that and remember it so I can write it down for her measurements. So I'm going to rapidly inflate to 180. And as soon as I get there, I'm going to hit the air release valve and listen for the knock to stop and start. So, immediately after the process is complete, we can take the cuff off the patient for comfort, and her reading was 120/80. So this brings me to my interpreting the results portion. As I mentioned before, 120 over 80 is the standard rate for blood pressure, and so she has a perfect blood pressure. Now, if her results were extremely high compared to 120 over 80, then she would have hypertension. Hypertension is more commonly known as high blood pressure, and according to the American Heart Association, 103 Americans suffer from high blood pressure. So that is a big issue that she would need to be notified of and taken care of with the doctor. The opposite of that is low blood pressure. If she would have had readings that were below 120 or over 80 drastically, that's low blood pressure, and that can also require immediate doctor attention. So, as I mentioned before, her results are normal. She's healthy. She shouldn't have any hypertension, hypotension, but those people who do get readings like that, they need to see a doctor. They need to refer to a doctor and see if that needs to be taken care of or if it does not require immediate medical attention. So in this demonstration speech, I hope I've made it clear how to take someone's blood pressure. I aim to do this by listing the equipment and the different tools required, the process of taking someone's blood pressure, and finally the results and how to interpret them and what to do when you get your results. Are there any questions?
Why would I need to know how to take a blood pressure manually when there's modernized tools out there?
I thought the same thing. I thought that manual blood pressure equipment would become obsolete because of the monitor and the digital equipment, but it's a very convenient and a very easy process to learn, and if you're in a medical facility that doesn't carry modern or digitalized equipment, this would be a very valuable skill to know how to operate one of these machines. Any other questions?
What made you choose how to take blood pressure?
I thought this was a very simple process to learn and to teach others. I was taught by my teacher in high school, and again, I thought this was very fun and interesting to know about about manually taking blood pressure, so I wanted to share it with others. Yes?
What is the most important part of taking someone's blood pressure?
Although there are many important parts of the blood pressure process, definitely interpreting the results is the most important part. If you give someone the news that they have a heart condition or high blood pressure, that can be a serious medical scare for them, and they can go undergo tests or consult with doctors when they really don't need to. Also, more importantly, if you tell someone they're okay and they really have a medical condition, that can lead to conditions as well and serious results. Thank you.